Hi, this is Ed Crowe. Back again talking about MA and PDP commissions for 2025 again. This should be my final update. This will be very different than some of the things that have been being discussed. So today we're going to go over what will be the update so you can rely on this information for 2025. It won't change from this point. So we'll talk about the CMS rule changes and how they will not go into effect for 2025 and what that means for you as agents. Basically, nothing's going to change. It'll be business as usual, so similar to 2024. Talk about what this means specific to commissions, HRAs, marketing reimbursements, overrides. One thing to note with these changes, the $2,000 drug cap will still be in place because that's through the IRA. It's different legislation. All of these videos you can watch. We do hundreds of them. They're on our YouTube channel, so just go to youtube.com/Crowe Medicare. And you can watch all the videos you want there. A couple quick things. If you do have questions, they can be asked at the end of the seminar, and I will answer them then. If you have any other questions, just call us at the office, 203-796-5403. Okay, so there was, obviously, as everybody knows, most likely there was a final rule put out by Medicare. It was going to make wholesale changes to the way commissions were paid, overrides were paid, HRAs, everything. There were lawsuits filed, and a stay was awarded in those lawsuits. So a stay just simply means that until the lawsuit is concluded, nothing can change in the meantime. And so that basically is going to mean that nothing is going to change for 2025. Everything's going to be the same. So if we have any changes, they're going to be for 2026 at this point. So the lawsuit was filed specifically to overrides because it was filed saying the CMS didn't have the authority to tell insurance companies they couldn't pay overrides to uplines. However, the judge applied the stay, granted the stay to all aspects of the final rule when it comes to agent compensation and commissions. So that's going to have some pretty big impacts on the things we were talking about with commissions for 2025. So what it really means is all the things proposed in the final rule will not be invoked for 2025. Who knows what 2026 will bring. So in 2025, nothing's going to change from the current, the way it's set up for 2024. So HRA fees to agents will be allowed for 2025. I've been talking about HRAs and how we no longer will be compensated for them. They will be allowed in 2025. How much will the companies pay? Will some companies decide not to pay? I don't know, but there is no legislation stopping them from paying under HRAs into 2025. Marketing money will also be allowed. We had talked about that marketing money no longer would be allowed. However, because of this, it will be. Now, what are the companies and the carriers going to give out for marketing money? I have no idea yet. I don't think they've had even any time to look at this and consider it. But it will be allowed. However, I will mention, I think even without a rule against it, marketing money was certainly going to be impacted by the $2,000 drug cap. I'll talk about that a little bit more in a few minutes. Overrides can be paid. The stand legislation has made it so carriers can pay overrides to uplines, to GAs, MGAs, SGAs, all the way up to NMO level. How much will carriers pay for overrides? Will those be lowered? Again, the $2,000 drug cap will have an impact on that, so to be determined, but they will be paid. The extra $100 and $50, so I'm referring to the extra $100 that was going to be built into commissions, and the extra $50 on the renewal will not be paid now as a result of this. So that extra compensation that was going to be put in the commissions for 2025 has been removed, and I'll show you the updated grid. So here it is. So without the extra 150, as I said, it's going to be business as usual. Basically, you're looking at, here are the max allowable commissions for 2025 with the fair market value adjustment built in. So as you can see, I won't read them all off. You've got California and New Jersey. You can see what it is currently. So the number, the 762, for example, is the current number for 2024. The 780 is the new number for 2025, and it's the same throughout the grid. So you have the new and renewal. Connecticut, Pennsylvania, and DC, they have their own bucket as well, and there's the amounts for Connecticut, PA, and DC. Puerto Rico and US Virgin Islands, they were standing to have the biggest increase, because when you added $100 to that, it would have been a huge increase, but now it's just the fair market value increase. So these are the 3 buckets of separate states that are separate from the national. And those last numbers will be the numbers for 2025. If we look at the national, that's all other states basically. You can see it's going to have a small increase on new from 611 to 626, and on renewal from 306 to 313. PDP commissions, I had mentioned in webinars earlier that they probably wouldn't be paid, because with the new legislation, it said that the carriers had to pay the additional $100 in addition to this, plus the additional $50, and it was pretty well known that the carriers probably just weren't going to pay commissions on PDPs at all to avoid paying that extra money. But now that it's been taken away, PDP commissions should be paid like normal, and there are the levels. That's a national grid for PDP, so that's PDP in every state, going from 100 to 109 on initial, and from 50 to 55 on the renewal. People often ask me, will the renewals be increased on my existing business? With most carriers, yes. They don't have to increase to the max for 2025 on all your existing business, but most of them, however, do so. So that will be a bump in revenue for agents with most carriers. Okay, so the stay that was put on the new legislation for the final rule is not applicable to the $2,000 Part D drug cap. The drug cap was part of a different legislation. That was the Inflation Reduction Act, IRA, and that is still going to be in place. And that's going to have wide-ranging repercussions and impacts on our business. So $2,000 drug cap will be in place for PDP and MAPD plans. This is a massive shift in cost to the carriers, more or less doubling what they pay, sometimes tripling what they pay towards PDP and drug costs, not just on PDP and MAPD. So as a result, because of that huge shift in cost, and it's a huge cost increase for the carriers, that certainly will have a negative impact on MAPD medical benefits. So yes, not just the drug benefit of an MAPD, medical as well. You'll see higher out-of-pocket maxes on plans, higher copays, less extra benefits as a result of this. It will certainly have a big increase to PDP premiums, a large one. You'll see PDP plans in many cases double in premium. And in some cases, for your really low cost Part D drug plans, the ones that are maybe $2, $3, $4, $5 a month, you'll see those things jump to probably $30 to $50 a month. And yes, there's a $2,000 cap on drugs, but you will see the benefits be reduced to get to that cap. So higher cost share before you get to the $2,000. So that will stay, and that will have big implications on other things like marketing money, on overrides, on how much a carrier will pay for an HRA fee to us to complete an HRA for somebody, health risk assessment on someone. The way commissions pay, and people get very confused about this, that's not going to change. So the way commissions pay will be the same. If somebody's new to Medicare, so they're brand new, there's no Part D in place, that will be full commission, and it will not be prorated. So whatever the full amount is, regardless of the effective month you sell it, you're going to get the full commission, no prorata, and the renewal will start in January. Now, what if they're brand new to Medicare and you write them an Advantage plan, but they already had a Part D in place? Maybe they were getting drug help and a auto enrollment for Part D was done. Well, what's going to happen then is you'll still get the full commission, but it's going to be prorated. So if you sold somebody a MAPD new to Medicare, but they had a D in place and you sold them for July 1, you're only going to get half of the whole commission because they were only enrolled for half the year. If you sold them for a 3/1 effective date, then you're going to get 75% of the total commission. So having that Part D in place, even though they're new to Medicare, triggers pro rata for commissions. So you still get the full, you get the new and the true up, but it's going to be prorated. And then if you sell somebody an MA to MA, so they have an Advantage plan, you sell them a new Advantage plan, that's going to be paid at the renewal commission amount, and it's going to be prorated both. So for example, if you sell somebody a plan for 12/1, you moved them from one MA to another, you're going to get 1/12 of the commission, and it's going to be of the renewal commission. The only good news is the renewal will start as earned in January for you. So when you sell MA to MA, subject to pro rata, if you sell them for January 1, you're going to get the full renewal commission. But after that, it's going to be prorated depending on the month you enroll them in. As far as all the changes that were proposed not being invoked, the carriers have already started to plan to be business as usual. We've had them tell us already it's going to be business as usual. So the new rules that were going to be put in place for compensation will not be. And we just went through the commissions and what they'll be for 2025. So there's a stay on this lawsuit. When a final judgment is made, the stay will be removed. When will that be? Who knows? But it won't be until 2025 at some point. So 2025 is going to be just like 2024 was. You'll have the same setup with the commissions. You'll just have that fair market value increase that we went through a few minutes ago. That's all we have. Appreciate you joining me. We are on a time frame today, so I won't answer questions today, but please feel free to send questions in if you have any. Just wanted to let you know we do have access to ACA contracts with overrides and bonuses for agents that are interested. And we also have a very unique Delta Dental contract for agents that are interested in selling standalone Delta Dental plans in all 50 states. Appreciate you coming on today. Thank you very much. I look forward to seeing you on a future webinar.